All right, hi everybody. This is part two of our interview with Dr. Nemec, who is a board certified veterinary dentist. And this week he is going to be talking about your questions related to diet, to dental chews, and to home care for dental health. Last week we talked about more the medical veterinary side of things. I hope you enjoy. We get a lot of questions about chews of all kinds.
Yeah,
Someone asked about the high durability chews. So
yeah,
horns, antlers, I should throw in there things like Himalayan chews, which are that really hard cheese. So
yeah,
do these harder chews carry a greater risk to teeth?
absolutely. We hear constantly, and then someone just said, my dog broke a tooth on a hard bone. And the thing is, this is what I tell clients, something's going to give. When your dog chews on something, either the product's going to give, the toy, or the tooth is going to give. Our rule of thumb as veterinary dentists is if you can make an indentation with your fingernail, it's okay for the dog to chew on. If you can't, it's too hard. And so the problem really comes down to the fact that anything that a dog should chew on is safe to chew on is going to be gone in 60 seconds.
Right.
And that's the issue that everybody has is that here I want something to last. Well, here's a nylon bone, here's this, that, and then they break teeth. What do we recommend from a safe side? We'll get to the dental side in a little bit. But I like Kongs. I do like rope toys. Yes, can they chew the rope off and have an obstruction? Sure, I've never seen that, but it's possible. I do like rawhides. I think those are fine. I like things like greenies and milk bones and stuff like that are fine. But when we start talking about those really hard things, they're too hard.
Any issue with a lot of people will fill those Kongs with wet dog food and freeze them. Um,
Probably not a huge big deal because again, like ice, that's gonna break.
break.
It's
Yeah.
it's gonna give to a certain extent. I don't have a real issue with ice either. I mean, I chew ice, so yeah, I don't think that ice is a problem. I think it's those things that are just pretty much indestructible.
Okay, next is specifically about dental chews. So chews at least that are
Yeah,
marketed as dental chews. Why do so
yeah.
many dental chews that claim to be cleaning dogs' teeth have added starches that can make dental health worse?
Again, the starches isn't really the problem. I mean, it's not great, but it's not the problem. The problem, what causes gum disease, is plaque. And plaque forms on the surface of the teeth. And once it gets up underneath the gum, it starts causing inflammation, which is called gingivitis. So, starches don't, in and of itself, when we talk about starches, that's all about cavities and it's feeding the bacteria that are causing the lactic acid production, which causes caries. In animals, we don't get that. We're talking about peritonitis. Now, can it feed the plaque? Yes, but the plaque is mature and as bad as it's going to get after 3 days of accumulation, no matter what you eat.
Do any of the
Yep,
dental chews and treats actually help?
absolutely. Yep. Now, a couple different ways to look at this. I will tell you my personal opinion on what I like, and then I'll give you some other options. But again, we need to look at products that are soft. One way for everybody to have a really easy job to do it, there is something called the Veterinary Oral Health Council. It's the VOHC. And VOHC.org has got a listing of all these products that have been approved. Um, do all of them work? Absolutely. Do all of them decrease plaque and calculus? Absolutely. Do all of them get all the way down to the gum line? No. The problem with most dental treats and the reason that they don't work is because they don't hold on to the tooth and scrape it down to the gum line. And so if you're cleaning the surface of the teeth, but not cleaning at the gum line, then you're not really doing anything medical. Okay. So if you're going to ask me which products that I would recommend based on my experience and my research, there's one that is like by far the best and nothing I don't think will ever be better. And that's not a treat. It's a diet. It's called Hill's TD.
Oh, really?
Tooth, yeah. Oh my God. There's nothing going to be better ever, in my opinion. And it's the kibble formulation. They have like a cross hatching fiber and it basically holds on to the tooth all the way down to the gum line, cleans it all the way down to the gum line. It actually has a label for treating gingivitis. There's another product that I really like called Oravet Dental Hygiene Chews. These are both prescription products. I'm sorry, but it's from a company called BI or Boring or Ingersoll or something like that. But it's a really good chew, and it also has an anti-plaque agent in it. Those are my two favorites. Nothing's going to be better than those two. And oh, by the way, for cats, TD as well. I like greenies. I think greenies work. I think rawhides work. They work really well.
Next question is about diet. Someone asked, is kibble the cause of dental decay, and do raw diets cause less decay?
So when we're talking about raw diets versus kibble, they don't, and when we talk about decay is generally cavities or caries. And that really doesn't happen in dogs and cats. It's never been reported in cats. We do see them in dogs incredibly rarely. I mean, maybe once a year. So when we talk about decay, can the starchy stuff cause that? Yes. But when we talk about dental disease in dogs, especially little dogs, we're talking about gum disease. And in my opinion, based on all the research I've done, I don't think it makes a difference between raw diets and kibble. No, kibble does not cause gum disease.
Can dental chews completely replace the toothbrush? Everyone's crossing their fingers.
No, because they don't chew with their canines and incisors.
Yeah.
So, there's studies that show this either way, but in general, the one that I truly believe, the teeth in the back are better treated with chews. The teeth in the front are better treated with brushing because there's no way hair in a dog. I mean, again, my Labrador I can, sure, but if you're really fighting with a dog, that those back teeth are going to be impossible.
Okay, next question. I can brush the outsides of my dog's teeth,
Yeah.
but not the insides. How much will this help?
Honestly, most of the disease is actually on the outside. So I would say it's going to decrease the gum disease by, I mean, again, this is anecdotal, 66%. So it's a heck of a lot better than nothing. Again, you still have to go in, even if you're brushing every day, you still have to get your teeth cleaned. We do too. And then that's where you kind of deal with that. But I find more pockets on the outside than I do on the inside, except if you have a dachshund, you really need to try to get to the inside of the zipper canines because they get really bad gum disease on the inside of the zipper canines.
Thank you so much. Those were all
Okay,
of our
cool.
questions. All right, so our message this month is learn to brush your dog's teeth if at all possible. And if not, there are other things you can do, like those at-home products and also veterinary dental cleanings to help your dog.